Chapter 7, Cancer Fundamentals, Symptomatology, Diagnostics, and Treatment. So what we're going to focus on in this chapter is what is cancer, how do I know it's cancer, um, how as a healthcare community do we classify cancer, um, and a few other things. High level overview. So we know that cancer is basically, if we sum it up, it's a disease where the cells, the abnormal cells or cancer cells, divide without control and are able to invade other tissues. So the normal apoptosis, where cell death occurs, does not occur in cancer. And those abnormal cells just keep growing and growing, and they actually don't respond to all the normal cellular controls that the rest of our body does. We know that we have abnormal cell growth that is benign, and we have abnormal cell growth that is malignant. And generally, the differences between the two look very much like this. Benign growth grows very slowly. It's usually well encapsulated and not invasive. It doesn't divide quickly, and it does not metastasize, whereas malignant tumors are generally poorly differentiated cells that grow very rapidly and have the ability to branch out into other areas of the body despite where it's growing. We know that the older that you get, the more cancer that will happen to you generally. Usually when young people get cancers, there's a genetic link. So we know that as cells wear out, and that cellular replication process in the body advances with aging, we have more cancers as people get old. We know that it takes multiple mutations to happen before a cancer cell develops. That's why it happens later in life, because we know that the more exposure you have to environmental mutagens, or the worse your diet is, the more mutations can occur, and therefore that's why cancer develops later in life. We know that there's a genetic component to most of our cancers. If we haven't isolated the actual gene, like we have with breast cancer with the BRCA gene, we do know that there is a familial. So anytime we haven't, isolated a gene to call it genetic, we call it familial. And we know that there are familial trends. We just don't know exactly what gene does it. The three big precursors, or the three big theories around cancer, have to do with inflammation. So that inflammatory process that we've been studying this week is highly important for all kinds of disease processes, but we know that it has a really high link in cancer. We know that there is some sort of immune system disorder with cancer that creates an environment that allows cancer to happen, as opposed to being filtered out through our normal immune system processes. And then there's the viral theory, and we're still not sure how this happens, but we know that there is a link to cancer with certain diseases, such as hepatitis, HPV virus, and we know that there's some sort of a viral process that creates those opportunities for cancer to happen. there's two kinds of spread. There's a local spread where the invasion actually takes place at a site um, that's local, as opposed to the cells growing in a primary site and spreading to a distant site like metastasis. Um, Metastasis usually occurs through lymphatics and blood. That's why we take lymph nodes to see if the cancer is present in the lymph node, because then that generally gives us a good idea that it has been carried off to other distant organs. Our study of cancer, while it doesn't appear to have advanced a whole lot, we really do understand now where certain cancers go and spread to. So, like triple negative breast cancer, um, if it has metastasized, usually shows up in the woman's lungs, woman or man's lungs, or brain as a secondary metastasis site. General clinical manifestations of cancer. So in the next few slides, we're going to give you a system by system signs and symptoms of what cancer generally starts looking like. So we know in general when people have cancer growing in their body, there's extreme fatigue, and this is probably the most frequently reported symptom. Lack of energy, exhaustion, sleeplessness, inability to concentrate. Basically, the body knows that something's going on, but we have no way at this phase to understand what that is or what it looks like. We also know that fatigue can be caused by a ton of other mitigating circumstances like sleep deprivation, low activity levels, psychosocial or psychiatric illnesses, the environment. So again, this general manifestation is one that we pretty much don't pay attention to. Clinical manifestations in the neuro system have to do with pain. Basically, in the early stages, there's little or no pain associated with it. But as the tumors grow, the pressure or obstruction or invasion of structures and destruction of tissue and that inflammatory process creates pain. And pain is usually what brings us in. And then when things are investigated, we usually find the malignancy. In the GI system, mostly cancer results as a syndrome of cachexia, which is the inability to eat. If I do eat, I fill up quickly. Weight loss without trying to lose weight. A general anemia that we would associate with lack of eating, but it's the combination of lack of eating and the clinical manifestations of cancer in the blood that really create this problem. Clinical manifestations in the blood, the biggest one that we see the fastest is anemia, a total decrease of the hemoglobin that can be due to chronic bleeding. It can be due to just how the cancer is manifesting, particularly if it's in a blood-forming organ, or it can be a result of the lack of eating or the therapies that we're giving to correct the cancer. Clinical manifestations in the immune system result in leukopenia and thrombocytopenia. So basically, you can look for cancer patients to have these signs and symptoms early on in their um, disease process, an increased risk for infection um, because of the neutrophil and lymphocyte counts. And this manifestation in the immune system is further aggravated by the um, therapeutic interventions that we do, particularly when we give chemotherapy, because the chemotherapy basically works by knocking out the immune system totally so that it will kill the cancer cells. Um, we haven't really perfected a good way for us to just target the cancer cells. So in general, we do the shotgun approach, and we give all these drugs that basically knock out the immune system along with the cancer in order to stop the growth. Clinical manifestations in the GI and skin. So basically, with patients who have cancer or are on chemotherapy treatments, you will see baldness or alopecia. You will see a lot of skin friability and breakdown and dryness because our skin is probably our fastest growing cells in the body. So anywhere where these skin cells occur, you're having this kind of breakdown and ulceration and issues. So think about that, that our entire GI tract is covered with epithelial cells. So that's why you see a lot of the malabsorption and diarrhea and nausea that comes with the therapies that we use to knock out the cancer. So when we're diagnosing cancer, we're diagnosing it based on where it has manifested or grown and how big that tumor size is. And then we do some additional testing to figure out what are the characteristics of that tumor. How fast is it growing? What is the mitosis rate? And things like that. We use a standardized staging system in the United States that is called the TNM system. And basically, we look at where or if the tumor has spread. We look at lymph node involvement to understand how significant the cancer is, and we look for the presence of distant metastasis. As you can see here, the stage 1 means there is no metastasis. 2 is local invasion. 3 is spread to regional structures around the initial local invasion, and 4 is distant metastasis. Clearly, stage 1 is better than stage 4. Each of these stages has a couple of substages, but really all you need to know for our purposes for this class are that there are 4 different stages, and this is what the stages mean. This is just a really nice visual delineation of the TNM system. Then we also look at the tumor to see what kinds of tumor cell markers and biological markers are produced by these cancer cells or found in or on the tumor cells in the blood, urine, or cerebrospinal fluid. Generally, these are hormones or enzymes. They can be antigens and antibodies. And through our cancer research, we have been able to identify certain hormones or antibodies and antigens that have led to development of treatments that are very specific to the cancer as opposed to that shotgun approach that I talked about before. In terms of cancer treatment, all of our efforts are targeted at stopping the growth. We use different combinations based on the genetic mapping, the type of cancer, the the tumor characteristics that we've talked about before. But generally, we start with surgery, either as a preventative mechanism or later on as the cancer grows and we lose control of the treatment, it can be used as a palliative measure. In order to use that TNM system, we have to do surgery at least to diagnostically determine the cancer cells and the staging of the process. After we've done that and determined what stage cancer the patient is in, there is usually a evidence-based protocol that's followed for whatever type of cancer it is that will include radiation or chemotherapy or both. So the goal of radiation is to eradicate the DNA cells in a localized way. The job of chemotherapy is to eradicate and or shrink the tumor or provide a systemic treatment, particularly with cancers that we know metastasize readily. And then the latest and greatest is immunotherapy, where we're actually working on the immune system and targeting specific cancer cells or how the immune system works in order to stop the growth of the cancer. Immunotherapy is not first generation evidence-based treatment for cancer off the bat. Our staples are surgery, radiation, and chemotherapy. But we do know with certain kinds of cancer, immunotherapy works. We just don't have the years and years of data to use it as a first line treatment. So a lot of your patients that are using immunotherapy may be in later stages of cancer, and this is one of the only therapies that is available to them in clinical trials and things like that, so that they're contributing back to the ability of us to learn more about cancer treatment through their willingness to use immunotherapies. That said, I know in breast cancer, if you are HER2 positive, and I can't remember what HER2 stands for, you are eligible for immunotherapy that we know actually stops the growth of this kind of a tumor in breast cancer better than others. So there you have it, a high-level overview of what cancer treatment and diagnosis looks like, and these are the core concepts that you need to understand related to the diagnosis and treatment of cancer.